You have entered your 9th month of pregnancy, and by OMSO, your baby from now on is full term, that is ready to come to this side. He can be born between 37 and 42 weeks. Want to know everything that's going on with your baby? Tip about childbirth: identify if it is childbirth, if it is not, if it is time to go to the hospital, if it is not. Very important food tip. I'll tell you something I don't think you knew about natural childbirth, huh? And a tip for this week. So stay with me and I'll tell you. Hello, I'm Monica Romero. I'm very, very happy to have you here with me. Finally, 37 weeks. Wonderful, your baby is completely ready to come over here and you're like, oh, with this beautiful heavy belly. And did you know that we have an organ that we only create for pregnancy called the placenta? I've talked a lot about it here, especially in the first trimester. And now is the time when the placenta starts to get a little more calcified. Why? Because it's starting to lose its function. She's starting losing its expiration date. But calm down, it's not to despair, it's natural for this to happen, and that's why we have a definition of placental degrees as it is here in this image that you can see, and this information is usually included in the ultrasound. Did you get an ultrasound of the 3rd trimester? Tell me. In some countries it is not common to do this ultrasound, so I want to know if you have done it, and when you have commented, they will let me enjoy the video, which is very important. I thank you. Let's continue this journey, you say. You have that feeling that you've been pregnant for about 5 years. You can't take it anymore. It's anxiety, it's the weight, it's the discomforts. Now, at the end, this 9th month, there is hardness, back hurts, heartburn, reflux. She has no position to sleep, and her life is already all planned after childbirth. So it seems that now she is just in a mess, and it is difficult to get through. That's why it's funny that every pregnancy lasts 8.8 months and a year, because the first 8 months seem like they are really 8 months, but this last month seems like time has stopped, that it doesn't take hours a year to arrive, but I swear it will arrive, okay? Breathe a little and it will work out. And what do you have to pay more attention to now? As your baby is ready to be born, you may start to feel more contractions. You may be entering a phase that is the first phase of labor, which we call Prodomos. What the hell is that? There's a summary here for you, but it would be a pre-labor, not yet entered. But those contractions, the Braxton Hicks that were painless, start to get a little bit more painful. And as they get more painful, they start to get more frequent. This period is like pre-labor. Some people don't even consider them as real labor. But for me, it is already like that. It is already your body starting this process to be able to receive your baby. After you go through the prodoms, that there is no dilation at this time, you go to the 2nd phase, which is called latent. At this stage, dilations begin. Then you will begin to feel contractions that are a little more painful, longer lasting. This phase still lasts a few hours. It can even take days, okay? Some people have this phase a little longer. And remembering that pain is a very individual thing. There are women who in prodams feel intense pain. There are women who, when they get there in the active phase, are still in bearable pain. So we cannot have a pain measurement that is common to all pregnant women. But since the contraction is a sign, you have to start measuring it, get a notebook and ask your support network, for your partner, for someone to write it down for you, because you write it down won't be easy. And you'll start writing down the time it started and the time it finished. This information will be of its duration. And then you will write down the next one so you can see the interval. And at this stage, these contractions can reach an interval of 10 minutes between one and another and last up to 45 seconds, right, of intense contraction. For most people, it's not time yet. It's time to go to the hospital, go to the maternity ward. It's still more comfortable to go through this period at home. You can walk a little. You can go to a square. The stock market may break at this time. It's not a rule. Some just go, right? Have this rupture during childbirth so you can rest assured Don't cling to this information. There may also be loss of the mucus plug when you ask for the plug. It may even take you 2 weeks to start labor, okay? So that's why it's important information that I'm putting here for you, but it's not time yet. But if you live very far from a hospital or maternity ward, then you can seriously think about starting this process now, right? To go to the car. But in the meantime, the things in the maternity suitcase, these things are already left there in the car. Already leave them in the way, or already leave the phone aside for whoever you are going to call to help you in this process, okay? Going through this second part that you were still evaluative, you could still cook, make a cake, then you had a contraction, then, oh, it doesn't come back, then I watched a movie. Moving from this phase, we move on to another phase, which is the active phase. At this time, the dilation is already passing 4 to 5 centimeters. The pain is much more intense, and you can no longer pay so much attention to what is happening in your environment. You start to focus more on your contraction, needing a lot, sometimes even help, right? Support you to walk. This phase can still last a few hours. It doesn't last more days. This one lasts hours. And between it and the expulsion phase, that the time the baby is born, you have a transition phase. This transition phase is also very intense. And it is what we call the time of cowardice, because there is so much pain. It is so intense that it is the time that people ask, oh, I want anesthesia like this. Then I give myself one. I want a cesarean section. I no longer want a normal birth. It is natural to happen, but it is in the short period of time. Soon it passes and goes to the expulsive phase, which is when the baby has already fitted there in the pelvis, already going to the vaginal canal. This phase has a characteristic that we call a circle of fire, in which the woman will feel as if she is burning right there, right? Near the vaginal canal, near the perineum. What happens is that when the woman is in this process of expulsion, the contractions are a little less painful. And you can feel the baby being crowned, right? The little head starting to appear, since there are some studies that indicate that when you can notice this, when you are consciously going through this, you can even allow your muscles to expand, and normal birth happens without lacerations. There is a chance that you won't have laceration because you are in control at that moment, but it ends up not being the reality for many women, okay? So if it doesn't happen to you, don't blame yourself, many women. Even if you have control, a little bit of laceration, which would be tearing a little bit of the perineum, can happen. And after this expulsion, you will have a last phase of labor called placental discharge, which is this organ that was already there calcifying. It doesn't have it anymore because it's in your body, so you'll also give birth to the placenta. Breastfeeding, it helps a lot. This part of you expelling the placenta, it usually happens within 15 minutes after delivery. If all is well with you and your baby, and he is taken for the first feeding, for you to breastfeed for the first time, this causes a uterine contraction and helps discharge the placenta. But what we do is a calculation of up to 1 hour. If this discharge hasn't happened within 1 hour, maybe you need a procedure, right? The doctor needs to pull there because of the retained placenta. Surgery may be necessary. Microsurgery will depend on your case. And in the case of placental discharge, some doctors can help, right? In this discharge happens successfully and end of labor, beginning of the mother's life, which can be first trip, second, third, fourth, fifth, sixth trip. I gave you a summary here of all these processes, these phases of labor. I have this in more detail in this video that is here, right? I'm giving you a summary to help you identify, and all these images are there on my Instagram, okay? So don't worry, run there to O Almanaca dos Pais. They are all there for you to save, consult whenever you want, and then you tell me, but oh Monica, I really want a normal birth, but my baby is still sitting. There is a chance he will turn into a... The chance now is very small because he is very big. But up to 37 weeks, some doctors, right, or obstetric nurses can perform a maneuver called VCE, external cephalic version, which they can turn this baby right outside the belly. After 37 weeks, this maneuver is no longer performed. It is very rare for it to happen, and even though it is performed until 37, not all professionals have this experience to be able to do this baby turn, okay? But But you will find out, for example, what it is possible to make childbirth drinking sitting down. Some doctors do this kind of birth, right? I give birth normally, but if he has it transversal, then it's not possible. This is an indication that we call the absolute indication for cesarean section. And remembering that this maneuver can only be done by those who have never had cesarean sections when there is no problem, especially the baby's heart, is not going into fetal suffering when the mother is also in her perfect state of health, has no pressure problem. Some cases of diabetes will also not be possible too. It cannot be done in twin pregnancy when there is little amniotic fluid or when already had rupture of the bag. Now, going back to the cesarean section, if you are going to have a cesarean section, then talk to your doctor that from now on your baby is ready to be born. So if you are going to have a cesarean section, can you schedule it, or have you already scheduled it? Tell me, and I promise that in this video, I will hold back not to cry, okay? I cried there at 32 weeks. I did cry. And I'm here holding on because I still think you're going to have one more week with me, but if you don't, it's okay because there's baby development. I won't let you go. Speaking of baby, let's talk about your baby who's all ready to come over here. You who are on this pregnancy journey with me already know that the measurements are only approximate, especially at this time. There may be a much greater variation due to genetic factors of the parents, but on average, if the baby is measuring about 48 cm and using about 3 kgs, if he manages to reach 40 weeks, this weight should rise to about 3 kgs and 300 gris. Remember that girls are usually 10% smaller than boys. And another important information, if your second pregnancy, probably your baby will be larger than the first 10% larger. Look, the cool information is that we say that the uterus has memory, so it can expand before the baby pushes, and it ends up receiving more food and growing more. Moms who also have diabetes or gestational diabetes usually have larger babies because they received more blood sugar that became fatter. I already commented at the beginning of the video that according to the World Health Organization, your baby is completely ready to be born from 37 weeks to 42 weeks. And this information is also important for mothers who want to be part of home care. If you want to have a home birth, you have to pay attention to all the symptoms and remember that you cannot have any health problems, okay? Because whatever problem you have or your little one has, you will be far away from a hospital to be able to be rescued in time. So if you have any health problems or being a baby, this birth will not be possible for you. But if everything is okay, up to 40 weeks, in some cases up to 42, but always with follow-up from the obstetrician, you will be able to carry out your home birth. And now I'm curious, where? It will be your birth, it will be home, it will be in a hospital or maternity ward, it will be normal natural cesarean section in the bathtub. What is your dream? What would you like? In my case, the 2 deliveries were cesarean section, but my dream, my will was that it was a normal birth, but I confess that I wanted analgesia because I didn't want to feel pain. Yes, there is this possibility that you are not medicated, that you do not feel the pain of the contraction, but know that it is happening to be able to exert force. But unfortunately, I couldn't. But everything is fine. I cried a lot. I felt bad. I looked for support. I couldn't find it on the internet. That's why I created the Parents' Almanac. So one thing was leading to another, and I have my 2 healthy children by my side, and I was healthy to receive them. That's more important. And it's even important to remember that while you're there with that weight, with that pain in your back, with that impatience, your baby is beautifully resting in your womb. Despite the fetal position, he's still in the best place he could be, and I guarantee he's happy there. Those little body hairs, which are the lanogos, they've shed even more, and some babies may even be born with it, but some others don't even have it anymore. And the casus vernix is also there in the amniotic fluid, which is important not only while it is immersed in the amniotic fluid, but in adapting to this side, which is a medium of the air, right? So vernix caseoso is important. That's why we don't bathe the baby in the first 24 hours. Let this vernix moisturize. Let protect the baby's skin for longer. And several moms choose not to use liquid soap at all. Let him go out alone, giving him a bath with only water. And that's what we need. Baby just needs to give water. But if you opted for soap, then you only hold a little, right? At least 24 hours for that first soap bath. And in my feeding tip, did you know that some women get a little embarrassed during normal childbirth because they can even poop during childbirth? You were worried, weren't you? First step, do not worry. It is normal to happen. All the professionals who will be there with you during your birth, they know this. They have already been through this. It is not embarrassing at all. It is going through a lot of pain. This can happen, but it is natural that our intelligent body, as it is, gave and emptied in the intestine a few moments before birth. Yeah, you can suddenly go to the bathroom, poop a lot so you can relieve yourself, but what about the gas? How does it stay, and will it release gas? During childbirth, yes. I mean, the odds are high. And what do we do? What if we don't want to go through this? We start to reduce our intake of foods that can cause gas, and I will list some of them for you. The first record holder is beans, which were not soaked because the phytate in beans causes gas. Then you can soak the beans for 24 hours, changing the water 2 to 3 times, and then cook. That'll help a lot. But there are other foods that also cause gas, such as chickpeas, soybeans, peas, cabbage, cauliflower, milk, milk products, eggs, sweet potatoes, and amazingly soda. Soda too. I'm not going to talk about beer here because I know you're not drinking it, because beer is also another big gas cause. But you don't need this tip. And for my tip of the week, I will ask you to write down this information that I will give you, mother. You have the right to choose who will be your companion during childbirth, whether it is a normal birth or a cesarean section. It is law. Law 11108 of 0407 to 2005, and it applies to any hospital and maternity hospital, whether SUS or private. You choose your companion. It's your right. Enforce that right. Even if you have to take the name of this law written there for you to question at the time, you are the one who chooses. It just won't be possible if it's a high-risk birth, some surgery that could even impact who would be on your side. But that's very hard to happen, okay? If by chance it is a birth, whether it is a cesarean section, whether it is normal, everything is happening normally, you have that right. One difference is that in some cesarean deliveries, the companion will only be able to enter after the mother is already anesthetized, okay? But he will enter and he will accompany the birth there by your side, be it your mother, your sister, your friend, it's you who chooses. And my last tip is for you to take advantage of these last weeks, maybe these last days, to enjoy that belly. I know it's hard, it's heavy, but photos will bring you good memories. In a while you will look, imagine this big belly. In a few days you will see your baby and you will imagine that he fits there. How did it fit? I wish you a great time. Not only great timing, but great turnaround, because it's first, second, third child. It's always a very intense change in our lives, and it's so positive. It takes work, but it is so delicious that it is definitely the best part of my life. They are my children, and it is what I wish for you too. Again, thank you so much for letting me participate in this incredible, unforgettable moment of your life. If your baby moves while I'm talking, he's the godson of my heart. I already got it for myself. I love a good birth enough for you. And if it doesn't happen this week, I'll see you next week, okay? Don't forget to let me enjoy it for me, okay?